team, we're going to get down to the nitty-gritty and talk about chlamydia.
Ooh. At your age, you're going to be having a lot of urges. You're going to want to take off your clothes and touch each other. But if you do touch each other, you will get chlamydia and die.
Whoa, chlamydia, what is that? Back in my day, when I was your age, all I worried about was typhoid and the bubonic plague.
Chlamydia is the most common sexually transmitted infection. It says that it's caused by a microorganism known as Chlamydia trichomatitis.
Sounds fancy.
Ooh. How in the world do you get that?
It's spread by sexual intercourse, or it can even be spread by without penetration.
Sandwich.
Don't touch her, she has chlamydia.
Everybody does.
No, not everyone does.
I'm pretty sure you can ask some of them A-listers, celebrities, on how you go about getting it, just saying.
That looks like a hot mess happening.
It is a hot mess.
But how do you know if you have it? Like, what are the symptoms? How do they test for it?
Well, back in the 50s, when I was in my journalism career, I did this piece on the Guatemalan syphilis experiment. It's horrible, horrible things. They would test for it. They would get cerebral spinal fluid and test for syphilis that way. Is that how you test for chlamydia?
No, simmer down. The old times have definitely changed since your day and age. Those who are believed to have chlamydia are warned of the signs and symptoms. For women, these symptoms include sparse, clear urethral discharge, redness and swelling of the infected tissue, burning with urination, and lower abdominal pain.
But I heard that the men can get it too. Is that true?
Them dirty birds. Men who contract this strain of bacterium can have testicular pain and swelling. Another symptom of both genders is that they can have anal swelling, which can lead to a mucus discharge.
That sounds painful.
Ooh, bad old days. Bad. That sounds terrible. How do you test for it?
Diagnosis is made by microscopic examination of the culture of the secretions. A test kit is available that identifies the microorganism in approximately 15 minutes. But I don't think they offer it at home yet.
Not like a pregnancy test or any of that.
If it's so
They
common,
should,
maybe they
though.
would. Yeah.
Yeah.
Maybe we should put a patent in for it, become millionaires.
Yeah,
Apparently it's an
we
outbreak.
should.
There you go. Okay, so now that we've kind of like established the signs and symptoms, like how do we go about treating it?
Well, I once did this piece on Alexander Fleming. He's the man that invented penicillin. That works for everything. Can you use penicillin for chlamydia?
Oh my gosh, Barbara, we've had so many advancements since your day and age.
Yeah, I read that a single dose of azithromycin or a 7-day regimen of either doxycycline, erythromycin, ofloxacin, and levofloxacin are prescribed as well. So you would have to take the medication for the full 7 days and also abstain from all sexual activities. But you and your partner have to make sure that you no longer that you don't discontinue the medication before the time.
Yeah, because I've also heard that chlamydia that's not treated can spread to the fallopian tubes and the uterus, which can cause pelvic inflammatory disease. This can lead to like long-term pelvic pain, infertility, and even an ectopic pregnancy. And even the men, like the epididymis, can become infected, causing pain and fever, which can also cause infertility. So permanent damage can happen, and if you do take the meds, that'll kind of help your symptoms, but if the damage has already happened, it's already happened. There's no fixing that.
You snooze, you lose.
What about abstinence? Do you have to be abstinent during treatment, or?
Well, it says that you do, that you should abstain from it, because if you have it, you're on medication, but you keep doing your thing, how is the medication helping you?
Right.
Yeah.
And there are things too that you can do. You can wear condoms. Females should avoid douching while infected. You should take the regimen. If you think that you're infected, make sure you treat your partner too. Take the medication, the whole 7-day regimen, or however the doctor prescribes it. And you also want to make sure you're not sharing any sex toys, because you can also transmit your infection that way.
Or you can just be abstinent. I mean,
Abstinent.
gosh.
Just
Be abstinent.
Save yourself until you're married.
Yes, and also all pregnant women should also get treatment, because they can spread it to the unborn fetus. With the fetal, they can either get blindness or pneumonia. Why would you want your child to go through that?
Yeah, that's awful.
Yeah. This is pretty informative.
Yeah.
Well, that's a good talk we had.
And, you know, it can affect the older generations, Barbara, and the newer
I feel
generations.
frisky, I ain't gonna lie.
And they say if someone's suspected to have chlamydia, you know, instead of getting just tested for chlamydia, you should get tested for gonorrhea. You should get tested for syphilis. You know, it's kind of like a gateway STD. You know, you can get so many more.
It's like glitter, you just keep spreading.
Yeah. The gift that keeps on giving. You know.
You don't want gifts, not gifts.
No.
No.
Well, I think this hot topic was pretty informative. I'd say we covered pretty good bases.
Yeah, I think it was a good topic.
You stay away from that dirty Judy bar, yeah?
Yeah, and Paris Hilton. Everybody.
Everybody.
Those kids.
Because everybody lies.
Everybody.
Have chlamydia.
Everybody lies. Well, I think that was pretty good, ladies. I'm Barbara Walters, and this is 2020.
No.
The View.
No, it's not 2020. It's The View.
Morning.
Good night.
The View.
Please wake up if you're falling asleep during the presentation.
Yeah.